Malaria Indicator Survey KMIS report providing data for monitoring core malaria control interventions in the country. Now, according to the survey, the burden of malaria in Kenya has dropped from 8% in 2015 to 6% in 2020. A malaria indicator survey report released today indicates that the disease prevalence reduced from 8% in 2015 to 6% in 2020 due to sustained interventions. In the malaria indicator survey report, 6% of children aged 6 months to 14 years tested positive for the malaria by microscopy. The report showed that malaria prevalence is higher among rural children than urban children. This 7% versus 3%.
In children aged 6 months to 14 years, and this was defined as a hemoglobin of less than 8 grams per deciliter. Again, was highest in the lake endemic region, where the malaria burden is highest, and seasonal transmission regions.
There is an estimated 3.5 million malaria cases and 10,700 deaths in Kenya, with those living in Western Kenya being more exposed. Speaking during the event, Dr. Willie Sahwale commended the efforts of all actors involved in malaria prevention and reiterated the president's support for all interventions.
In the year, there's an Alma Youth Army that guides the formation of youth across the continent. The idea being that the youth must be in the forefront, they need to participate in international fora at the African Union and globally to really press for malaria to remain a high priority. And here in Kenya, we launched the Youth Army in July this year, and I'll tell you what plans we have for them. So, what are some of the priorities here in Kenya to ensure that the President's legacy agenda is sustained?
Early in the month, the World Health Organization approved a vaccine against malaria that should be widely given to African children, potentially marking a major advance against a disease that kills hundreds of thousands of people annually. Brian Amuai, Look Up TV, Nairobi. Okay, away